delivering some grocery bags to supplement the food. So far they've received 2 of those grocery bags, which those are all shelf stable also, as well as some bread, which everyone was kind of thrilled to receive. We'll be doing 2 more deliveries of those over the next 4 weeks. So that's really helpful. We've had quite an increase in the number of people receiving the meals. We are currently serving about 440 individuals each week, and that equates to about 2,200 meals. So kudos to our kitchen staff. They're not, hi, Michael Blackwell, how are you? Sorry. Without our wonderful, hardworking kitchen crew, we would not be able to do it. That, just to show you what an increase that has been, that equates to a 55% increase in the number of individuals receiving meals from us right now. That's a big increase. I think it's stabilized. It grew and grew and grew up to, I think the highest week without the shelf stable was about 2,500 meals, and we seem to be hovering around 2,300 meals. But the meals are really important. But one of the things that we say about our dining rooms is that it's not just a meal. So people come to the dining rooms, they do enjoy the meal, but really it's the socialization that they come for. They create a little family groups at the tables they sit at, and they provide support to each other outside of that. So that's, we're missing that right now. And with our home delivered meal participants, we've gone from, we always tell our drivers in pre-COVID times that connection with the participant they serve is so important. And they go up to the door, sometimes they take the meal into the house, and they have a small, minute chat with the person, a minute check-in with the person. And now we have to go up to the house and we hang the meals from their doorknob, or we put it on a table by their door, we ring the doorbell and we step away. And then we make sure that they actually come to the door and pick up those meals. So that's a really big change. Because of that, and because of the importance that we see in socialization, we're making phone calls. We've got various staff members, from the dining center coordinators to the drivers to a social worker, calling folks who receive those home delivered meals, and some of the folks that we have the contact information for that come to the dining centers, and just trying to, just on a weekly basis, make contact with them. If they need connection up with more services, then those people pass them on to the social worker, who's very aware of the services in the community. We've sent out to both congregate and home delivered meal participants packets with newsletters and word games like word searches, crossword puzzles. We've sent out information packets, and we've connected them up, made sure that they're aware of the friendship line within the state of California, which is a really good resource if someone is needing to have contact with someone. And then there's another organization out of the Bay Area through covid.org called Well Connected. And we sent out brochures. I don't know where my camera is. There it must be. We sent out their brochures to everyone. And the great thing about Well Connected is that they were in place before COVID-19. So they have online classes, they have and a lot of it you can do through a telephone. You don't have to have a computer. So they can do classes, they can just form chat groups, they can even take a travel log through their phone. And so this is one way that we've worked to try to connect people up. What the future holds? Right now, to be truthful, we're exploring whether we can maybe bring one small group of individuals at a dining site in to have lunch one day, because the parameters are maybe in our dining room we can have 10 people. So we've moved the tables all around, and maybe we'll talk to one of those tables that we know is so connected in the dining room and invite them to come upstairs and enjoy lunch for a day. We have to check and see where they are, just because we're eager and really wanting to see their faces and have them in the building. I'm not sure if they're ready for that. And so we're taking it a step at a time. I know it's valuable. I know that our participants send us notes when they pick up the meals. They email us and tell us how grateful they are. But I know that they're missing the social connection, which we are too. But we'll figure it out, and we'll get back to people in our building, and we'll have good life in the building again soon. So that's just a pretty quick overview of nutrition and activities. Before I pass it on to Andrea, does anyone have any questions about that program at all?
Yes, do you have a time frame? Are you going to survey your people in order to find out if you've got a group that's willing to come back and try it out?
We're going to be talking, I'll be talking to the coordinators in the next week and have them pick a table that they want to talk to, and they'll be questioning them as they pick up their meals. So hopefully we can do it within the next 2 to 3 weeks.
Good. And Roland asked, how is the center funded?
For the Humboldt Senior Resource Center has a variety of funding streams, which I will let Melissa respond to, but I can tell you with regards to the Nutrition and Activities program, about 50% of our funding comes through the Older Americans Act. That comes into our county through Area 1 Agency on Aging, and then we get a portion of those funds. The rest of that is fundraising, which can be grants. We've had a great support from St. Joe's Care for the Poor for a number of years, and St. Joseph's Emergency Food and Shelter out of Orange County. Meals on Wheels, of America, the national organization, we just received a nice grant from them in response to COVID-19. And for the participants, although there's not a fee for our dining centers or the home delivered meal folks, we do request a donation. So they do donate. I have to say donations have gone down quite a bit since COVID-19 from that group, but we do, the community I think is stepping forward. So there's lots of pots of money that we have to dip into to make this program work.
And one other, I want to let everybody know, if you go on to chat, you can see how Michael Blackwell and Melissa Hooven responded to Rowan's question, which I hadn't read before I asked it to you. But I do want to also say, what happens if this goes on, we have a resurgence in the fall and everybody's too freaked out to come?
We'll keep providing meals. Yeah. We've got our system down now. We're not gonna walk away. I think they depend on them, and I think we'll just keep going.
Do you have any idea how many people are actually using things like the friendship line and Well Connected?
I don't.
No. Or the games and information you're providing? That might be interesting to find out.
Mm-hmm. It might.
Yeah. Well, thank you.
Thank you.
And we're going to go on to
Andrea.
Andrea.
Yeah, before you go, I have a quick question for you, Barbara.
Yes.
Once upon a time, and I don't know if this is something that the nutrition program has been providing recently, but in years past, I know that you all used to assemble sack lunches in the summer for kids. Is that something you're still doing? Is it just completely out of the question?
We coordinated that with Food for People. It's not going to happen this year between Food for People and us. We both made the decision, the capacity wasn't there. But before Food for People made that final decision, they did set up with at least Eureka City Schools to provide meals for the children. So they'll still be getting the meals. It just will not come through the collaboration between Food for People and the Humboldt Senior Resource Center.
And Susan Halpin had a question, how many volunteers do you have and how many do you need above and beyond what you have? And how should people contact you to be volunteering?
Right at this time, we're not using volunteers. We're using our staff. We felt when we went into the shelter in place, it was important to reduce down the number of people that we were using, and to so we decrease the exposure for everyone. Right now, we're able to fill everything in. Because without people coming into the building, some of the staff hours, there's been a lack of work for some of our staff. So it's been our goal, rather than bring volunteers in at this time, to keep our staff as fully full of their hours as they can. So right now, until the shelter in place, we're not using volunteers.
That makes total sense. Thank you, Barbara.
Thank you.
Any other questions, anyone? Raise your hand if you've got it, if you're visible. Oh, does your dog does Hop have a question, Jeanette? I guess not.
Thank you.
Okay, thanks, Barbara. We'll go on to Andrea.
Hi, good afternoon. I'm Andrea Bruhnke, and I'm the Director of Adult Day Health and Alzheimer's Services. I'm glad to be here with you guys today. And it's nice to see some familiar faces. I see Doug Durham. Hi. So I'll tell you a little bit about Adult Day Health and our services under our normal circumstances. Adult Day Health is a medical model day program, and we serve adults over the age of 18, although most of our participants are 55 or over. And they have a variety of mental health, of chronic mental and physical diagnoses. And in our center, we have a number of services. We have nurses, social workers, we have physical therapy, occupational therapy, we have an individualized activity program. We have access to a registered dietitian that does assessments based on referrals. We provide transportation for our participants to and from the day center. We also contract with a speech therapist, and we have a licensed clinical social worker that our participants can be referred to as well. And normally our participants would come. They have a regular schedule of attendance Monday through Friday, 8:30 to 2:30, and some people choose to come just one day a week, and some of our participants will come up to even 5 days a week. And so even though we have all these wonderful services and licensed professionals that work with us, the overwhelming reason why people come to Adult Day is for socialization and respite. Those are kind of the two main reasons why our participants come. So the COVID right now has been a major strain on our participants and also their caregivers, certainly. Our current enrollment is 73 participants. That was as of last week. I think we're actually going to be disenrolling a couple of participants, but 3/4 of our participants are low-income Medi-Cal recipients, and they pay for services, or our partnership health plan is the managed care organization that pays for them to come to Adult Day, and they pay on a day of attendance basis. We have about 15% of our participants that are veterans, and so the VA pays for them to attend, and then just a handful who either pay privately or are clients of the regional center. So in response to COVID, our last day of in-center services was Friday, March 13th. And pretty quickly our staff kind of mobilized to determine what our participants' needs would be while having to be at home and not attending the day center. So they kind of identified those participants who were sort of at high risk if they weren't coming to the center, maybe based on their health diagnoses, or did they have some nutritional needs that couldn't be met, food insecurity. So they kind of looked at that to see how we could help them in home. And then over time, those services have really kind of shifted, and we've had to get really creative about how we can take care of our participants at home while we can't be bringing them in here. And one of the things that we're doing is we've sort of developed care plans for each participant that to fit the shelter in place. And so each of our participants gets at least a once weekly COVID screening call, and that's either done by one of our social workers or one of our nurses. And they assess any kind of symptoms that they might have that would indicate possible COVID. They talk about contacts. They do a little bit of education with them as well regarding social distancing and sort of safe ways to shelter in place. Fortunately, we haven't had any cases, and in no positive cases. We did have one of our participants that was tested, but that test turned out negative. Another thing that we're doing for participants is providing individualized weekly activity packets. So those are sent out to them by our transportation department. Those have been really great. Our staff have made those individualized. So we have some participants, for example, who like to do gardening, and so they've kind of put together these little gardening kits that they can do at home. We have participants who maybe they're into cars or whatever kind of they're into, and we'll provide our care staff have been really creative and have sent packets that give them reading materials for things that they're interested in and different activities like that. We also do, we're in coordination with our nutrition and activities program. Of course, our participants are also getting frozen meals delivered to their home. And that's just a handful of our participants who have food insecurity. So they might get, usually it's about 3 to 5 meals a week that they get delivered to their house. The thing that has developed during this time that our participants are really enjoying is Zoom groups. One of the things that our staff talking to them on their regular phone calls is that they've really kind of missed the connection that they have with one another. A lot of them have been in our program for many years and have built some really close relationships. And so it's been really hard on them to not be able to see their peers on a regular basis. So they're now doing Zoom groups where they get to see each other or just talk to each other. So that's been a really positive transition that we're making over time, and kind of we have to sort of assess the participants' abilities to call into Zoom, if they have caregivers to help them do that, what kind of capabilities they have to either log into a computer or make those phone calls. So that's taken some time, but it's really developing into a cool schedule of groups that our staff call just checking in with friends. We also have some participants who are on some regular walking schedules now. So our care partners will go to their homes and practicing safe social distancing. They knock on the door and they just go out on a walk with them around the block. And that's been a really positive thing for them. And then we just have our staff calling and doing individual phone chats. And if they kind of see any sort of need that isn't being met during shelter in place, they bring that back to our multidisciplinary team, and we can do some care coordination around that to fit those needs. We're also doing delivery of personal protective equipment. So all of our participants in all of our agency got masks delivered, and those were provided to us by a community member who made masks. So we were able to give all of our participants masks. And then some will say, if they need gloves or anything else like that, we do the delivery of those supplies as well, and any kind of medical equipment. So one of the big shifts that we've had to make is that our nursing and our social work have turned sort of to an in-home case management model. One of the issues that we're really seeing is that this isolation has really resulted in some significant declines in a lot of our participants. We've seen participants really declining in their ambulation, more falls. We've had an increase in behavioral and psychological symptoms of dementia. So that's things like agitation, wandering, sleep disturbances. That's kind of gone up for our participants with dementia. I think a lot of that can be attributed to this big change in their in their daily routine. And of course, those things really kind of add stress to caregivers. So we are seeing a lot of caregiver burnout. Our social workers are turning into oftentimes a bit of a counselor and a sounding board for our caregivers as well. And we've also had 2 of our participants that have been placed in skilled nursing facilities since this started. And we really, I think our multidisciplinary team really believes it's definitely related to having to shelter in place and some of these declines that we're seeing. So that just really highlights the importance of our program and kind of the services that we're able to provide to the community. We are currently in the process of starting to look at what participants we can bring back into the center safely, and that's really based on looking at having a risk assessment of are they under more risk by staying at home than they are if they come into the day center with a little bit of with some increased risk of exposure. And so for those participants who we've really seen some declines and we think we could provide some targeted services, we're looking at how to bring them in safely. So some of the things that we're doing to mitigate that risk is doing screenings prior to boarding the bus if we're going to be bringing them in. We're going to be screening them when they come into the day center. We have limited participants that are allowed to be on the bus. We are doing daily temperature and symptom screenings of all of our staff, and that's something we've been doing. We're making it a requirement that our participants also wear masks and have personal protective equipment, and I suspect that for some of our participants with dementia, it's going to be a little bit of a challenge to enforce that, but I'm pretty confident that our staff can be creative around that and see how they can help our participants to practice take those measures safely. And just regular disinfecting, of course. So those are just some of the things that we're putting into place as we consider bringing our participants into the day center on a pretty limited basis. We are enrolling new participants. This is something that we just started doing a couple of weeks ago with the understanding that we're not going to have our regular in-center services. So we have had some interest in continuing to enroll, even though they know they're not going to be coming into the day center. They see some value in the weekly check-ins and the ability to get some home delivered meals if that's what they need. Some care coordination if they need that as well. So people have been open to enrolling into our program even though they can't come into the day center. An additional service that I'll talk a little bit about is our Alzheimer services. We have a resource library that's normally available to the public. Right now we're not having people from the public coming in, but we also do individual counseling. Usually that's telephonic counseling for caregivers of people with dementia or Alzheimer's. So we are still doing that over the phone. Anybody from the community can call in and get information, referrals, and a bit of education and some support as well. And lastly, our big sort of event that we plan every year is a dementia care conference. We had to reschedule that. That was planned to be in April, and we had to reschedule to September, but now this has really kind of gone on a lot longer than we all expected. And so without really knowing what's going to be happening in the next couple of months, we've had to just put the brakes on that entirely and postpone it until next year. So that's a bit unfortunate, but our sponsors have been really open to that, and our speakers have been open to that, and I think we'll just move forward with planning for a conference again next year. It's an educational conference around the topic of dementia. That's all I had to say about Adult Day. Before I pass it on to Barbara, do you guys have any questions about Adult Day health?
I have a question about, I've noticed and been participating in a number of online medical programs that have been put together in a series of episodes online. And I wondered if you've considered putting your conference together rather than having to continue postponing it, whether you could do it via Zoom. and make it available earlier so that
Mhm.
caregivers could get the benefit of that. And I have some examples that I could send to you if that would be of interest.
Yeah, we have the Dementia Care Coalition plans the conference together, and we're kind of the main player in that and putting it together. We did discuss this. I think there requires a level of expertise in putting together a big educational conference. I sort of had to learn on the fly when I planned it last year. And it really was a significant portion of my job was planning that conference last year. And so kind of changing gears to plan an online conference at this point when we're looking at opening Fortuna, dealing with kind of the weekly and daily things that we have to deal with COVID right now. It just really wasn't something that any of us could undertake, was planning an online conference.
And there was a question from Nina about any news on the new Fortuna facility. Oh, and the answer was we anticipate opening it in July. Is that still online?
There's a few different pieces with that. I don't know if Melissa, if you want to address that question, but that sort of time frame and the target's always kind of changing a little bit. Like I said, we're kind of having to adjust on a weekly basis almost with what's happening, but that is pretty close to our timeline.
Correct. So as it stands right now, we are anticipating opening at some point in July just for PACE participants, and hopefully in August for adult day health. So that's our plan. We're waiting for a final contract from CMS, which we are working feverishly to accomplish that. And we're really close. We just had to upload a document to their system. We did that this morning. And they are working really hard to get this accomplished for us. It's been a long process. They've been wonderful, and working with CMS and the federal government on any level is extremely difficult. But I will say that they are behind us and they want to see this done. So yes, again, as it stands right now, we're hopeful for kind of a mid-July opening for PACE participants, and that would primarily be just for clinic use at this point. But again, as Andrea said, it's ever evolving.
When you say clinic use, what do you mean clinic use?
For participants who need to come in for a clinic visit.
You mean as in PACE?
Yes.
Okay, good, thank you. All right, any other questions, anybody? Did I miss anything? No, I guess not. Okay, then we're going to go back. Thank you very much, Andrea, and we're going to go back to Barbara. Or forward to Barbara. Barbara LaHaie. Am I pronouncing that right?
You need to unmute yourself.
Yeah, I think I got
There you
it.
go, Barbara.
Hi, good afternoon, everybody. I'm excited to be here and talk about Redwood Coast PACE. Most of you probably know we're considered an all-inclusive program for seniors to do what we can to keep them in home. These typically are seniors with progressive medical conditions, which put them at risk for placement in skilled nursing facilities. We currently have 205 participants. We do kind of a wraparound approach. So that involves having a full medical clinic, in addition to having the day center services that Andrea was able to talk about. We have an occupational therapist, a physical therapist, social workers, registered dietitians. So in addition to the clinic services and the day center services, we also provide in-home caregiving for assistance in getting dressed, showers, meal preparations, medication management. We also provide transportation to the center, to the clinic, and to other specialist appointments. And then as both Barbara and Andrea mentioned, we provide frozen meals for them to have in their homes when they're not in the center. We provide a medical provider on call to our participants. 24/7. So if they're having any medical concerns, they have access to our medical team. In terms of how things have changed, we limited the clinic use for a while, really bringing in people with high needs, and then our providers were doing the rest of the nurses, the nurse practitioner, and our physician was doing services in the home. We began to open that up a little bit because what we found is that we had participants who were saying, no, I'm just fine, and then upon sending somebody out, had a pretty significant wound or cough. So we're really wanting to keep a closer eye on our participants. So we're expanding the clinic. In the last 2 weeks, we've been bringing people into our day center. Those are people who are kind of like on a 24-hour watch. We really want to be there to kind of see how they're doing. A couple of them have some pretty significant wound issues, as well as we have participants with dementia that just have not done well without the routine of the center. So we worked on a pretty in-depth plan to make sure we had appropriate social distancing and the proper PPE to bring them in safely. And I think their families and they are really, really appreciating that. So I think most of our work kind of shifted into kind of a home visit model. But what's really been a deal changer, and we really appreciate the support of the community, is the ability for our participants to have tablets. So we were able to get funding together, so each of our participants can now have a tablet, and that's been really incredible. So, you know, the nurses, the occupational therapists, the physical therapists, the social workers can do a telemedicine approach and be checking in with the participants. And that's just been amazing. And in addition to that kind of telemedicine approach, it's been great connecting the participants to each other. So they do these Zoom bingos, and we have exercise classes that they're all doing together, and they can see each other. They're waving at each other. We have a Friday afternoon concert series where we've had musicians, local musicians who, you know, volunteered to play for an hour. And the participants are getting up and dancing and swinging, and so those tablets just are just an incredible tool for us to connect our participants. So we're really happy about that. In addition, I think, you know, Andrea talked about this. We have activity bags that are going out to our participants, and we're doing weekly calls. So I think that we're funded through, we're actually a health plan, and so we're funded by Medi-Cal and Medicare. So I think, and we're continuing to enroll participants. We're really excited about the Fortuna site. It's been a long haul, a lot of work, and really excited about having a full clinic in Fortuna for our participants, and then as appropriate, bringing them in for kind of an adult day health center experience. So thank you so much. I don't know if anyone has questions.
Yeah, I read in an article in the paper, oh, I don't know, a week or so ago. Whoops, something happened. There we go. I don't know what's going on. Okay, I read an article in the paper that Newsom's new budget was going to cut a lot of money out of services, particularly senior services. And do you have any idea what's happening with that, and whether we all need to be lobbying in order to make sure that doesn't happen?
Yeah, I think Melissa was probably going to cover that as towards the end of this presentation, so I'll kind of pass it on. In terms of PACE, we're okay. We were not included into the governor's budget.
Oh, okay, sure. You're federal.
Yeah.
You just have to worry about Congress.
Yes. And Medi-Cal, and we have a capitated rate system, and all indications are there's not going to be any impact to our current rates. So we're happy about that, but our feelings for our other programs in the Senior Resource Center.
Anybody else have questions? I'm having
So there was a-
problems.
Yeah, there was a question in the chat room. I think I covered it, but we currently have 105 participants in our program, and we are continuing to enroll participants.
That's great. Anybody else with questions? Melissa, do you want to close?
Sure. Samantha Day is our director of the Multi-Purpose Senior Services Program, and she's not with us today. So I just wanted to give a brief overview of MSSP, and that will kind of dovetail into our discussion on the budget and what we're doing. I want to read a statement that Samantha provided that we have been using in our advocacy efforts opposing Governor Newsom's budget cuts. She says, you know, for over 40 years, MSSP has kept the oldest, poorest, and the most frail Californians out of long-term care facilities by serving nearly 12,000 individuals 65 and up in their homes and communities. Most live alone, subsist on approximately $1,000 per month, and have complex medical and psychosocial needs, which require specialized supports. MSSP staff work tirelessly to meet the complex psychosocial needs of these older adults, often providing the only social interaction they receive outside of their caregivers. Now, that was just one statement in, again, our advocacy efforts, the letters that we've been putting out. For Samantha, her program has had the least amount of change during this time. Most of our participants in the MSSP program are used to contact over the phone. So fortunately, they have not been disrupted too much now, and we are doing enrollments, so that's a good thing. The flip side of that is that, as all of you are aware, there are proposed budget cuts. That has trickled down to our participants, and that's difficult for us to navigate because we want to make sure the information that we're putting out is accurate but not alarming. A lot of our participants can get very, very upset, and so we're very careful about what we put out and how it is presented to them. Some good news that we've had, you know, it was shocking when the governor's revised budget came out in May. We were all just completely floored, to be blunt. It's so counterintuitive to his stance on aging that it is truly mind-boggling. But last week it came out that the Senate and the Assembly are both in agreement that those programs should not be cut. So MSSP, CBAS, which is our adult day health, and a significant cut to senior nutrition programs were all lumped in as some of these proposed cuts. But again, fortunately, they've come together, and the Senate floor report, or the Assembly floor report, came out last week opposing those cuts. Those cuts are not in the proposed budget. So it'll be interesting to see what happens next Monday. Again, we're cautiously optimistic that with the provisions that are included in this new revised budget by the Assembly, that our programs will be preserved. But as you can imagine, that has been just devastating for us to, you know, have to even to accept that that could be a possibility. So it's had ripple effects. We spent so much time building up these programs, and to be slated with just the thought during, you know, COVID of all things is just really problematic. So at this point, again, we're optimistic that that will not happen. We will not know what will happen as of, you know, until June 15th. It was slated that MSSP could have been cut as early as July 1. So there are some markers in place, and about the end of this year, that could happen if the budget is not accepted. And then adult day health was slated for the beginning of the year. So it's really hard for us to present a plan. We have no idea moving forward what this means. All we can do is just take it day by day, kind of have a tentative plan in place for MSSP should we be given the devastating news that the program will be cut. it doesn't seem likely, just from all of the calls that we're on and, you know, the analysts, because again, when you look at the budget, they really wouldn't be saving that much money. There's a thought out there that it was really put out to shake up the federal government because we're depending on some federal monies, our state is. So the thought is, did Governor Newsom put that out there just to try to put a spotlight on the devastating ramifications that non-receipt of federal funds would do to some really valuable programs? So it's kind of all over the board. We're all trying to remain calm and just really thoughtful in our actions and what we do on a day-to-day basis. You know, again, I touched on how difficult it is. We have a lot of people, 140 people that work here. So they have to look at themselves, not just the participants. You know, this is for their health and well-being, and everyone's been working very hard during some very troubling times. And so we just continue moving forward, trying to make sure that our staff is whole, making sure that our participants are being taken care of to the best of our ability, and we're doing a pretty darn good job. We were really lucky in the beginning. We were one of the organizations here in the community that received the payroll protection monies right off the bat. So we were able to keep the majority of our staff fully funded, if you will, you know, earning paychecks. I think that we're 97% back to capacity, meaning that 97% of our staff are back at work. So it is a little bit scary for us because we have to navigate this new time moving forward with programs kind of modified. But as it stands now, all of our programs are fully funded. Barbara touched on PACE, and PACE has had no cuts to their programs at this point. So that's a huge relief for us. That's something that we don't anticipate happening. So that's kind of a snapshot of where we stand. I think that the Senate and the Assembly have done an amazing job, and I think that they heard us, they heard our voices. You know, the advocacy was swift in opposition, and, you know, everyone's voice holds power. And so this is one of these times where you see firsthand the actions that are taken and the potential outcomes for good.
Well, thank you ever so much. Does anybody else have questions? If not, thank everybody for participating. Thank you for the speakers for coming today. All of you gave excellent information and much better update than we can get in the time standard. So
well, I would like to say, can I interject, Jane, real quickly? You know, I should have mentioned Senior News. We love our paper, but we don't look at it as ours. It's a community paper. And I think that Senior News and Ted and Liz have been doing a phenomenal job putting out content for our community that's really insightful and heartfelt and, you know, very specific to the needs of our community. So I just wanted to really recognize that program within HSRC that is doing a tremendous amount of good right now.
I agree with you. And does Nina want to make a comment or ask a question? She's been waving back and forth. Nina, if you do, unmute yourself, please.
Thank you. I was trying to find what MSSP stood for, and it disappeared too fast. It's multiple something.
Multi-Purpose Senior Services Program.
Multi-Purpose Senior Services Program. Thank you so much, and thank you for all of you being here. This has been very informative. I'm old and I appreciate it. Thanks.
We're not old, we're older than we were yesterday, right?
We all are.
Thank you ever so much.